Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Tooth Talk, I have Dr. Subhash. To give you a brief introduction about Dr. Subhash, Dr. Subhash did his BDS from the Oxford Dental College, Bangalore. He did his post-graduation in oral medicine and radiology in the year 2009 from RV Dental College, Bangalore. He has a PhD from the Rajiv Gandhi University of Health Sciences, Karnataka in the year 2016, and his research subject was temporomandibular joint disorders. Dr. Subhash is currently working as a faculty in the Department of Oral Medicine and Radiology at RV Dental College, Bangalore, and he has been into teaching since the year 2009. And currently, he is the reader in the Department of Medicine. On the professional level, his area of interests include temporomandibular joint disorders, ultrasonography in maxillofacial imaging, tobacco cessation programs, salivary diagnostics, etc. He has visited Showa University School of Dentistry, Tokyo Dental College, and Niigata University for training in advanced imaging modalities. On the personal front, Dr. Subhash loves traveling, farming, and collecting coins. Dr. Subhash, sir, thank you so much for joining me in today's Tooth Talk with your dentist conversation, and a warm welcome to you.
Thank you, Dr. Rekha. Thank you for inviting me. It's a pleasure to interact with you, as always.
Sir, you mentioned that your interests is especially with what we call as the temporomandibular joint. Now, I think most of our patients, I'm not sure, are very aware about what this joint is and what is the kind of most commonly problem they can have associated with this joint. So can you just very briefly tell our patients about that?
Sure, doctor. Temporomandibular joint is a kind of a joint where the skull, the skeleton skull articulates or joins with the rest of the face, that is the mandible. Okay, you have the skull, which is a stationary thing, and the mandible, which helps in movement. This is the only movable part of the skull, that is the mandible, and this gets connected to the stationary thing via temporomandibular joint, because we have two bones acting here, that is temporal bone and the mandible. That's why the name temporomandibular joint.
Right.
And this is a kind of a very balanced joint. We have two joints, and each joint compensates for the other and gets injured if the other is injured. It's like a twin brother or a twin sister. Like one joint has an effect on the other. It's not like a knee joint where it's only one right side knee, left side knee. Here, though it is right and left, we have a mechanism where it is all connected to a single thing, to the brain, information system, and you get the disorder because of one joint is diseased, the other joint also acts in a funny way. So that's one speciality of this joint. And this joint has a unique structure where a soft pad-like structure intervenes between the hard components of temporal bone and the mandible. And this we call it as a disc. For a layman, disc is nothing but a shock-absorbing soft pad-like thing, which is there between the movable part of the lower mandible and the temple bone. So all these things are connected to each other through what I can call it as wires. So a layman, you can just imagine there are some suspensions or some wires which connect the disc to the mandible as well as the other structures in this area. So we call these as ligaments. Okay, so the entire joint is so well formed and well placed in this area that when you want to open, these ligaments or these wires act as springs, and they allow a particular distance of movement is allowed. Maybe say you open for 10 mm, 20 mm, it is allowed. Beyond that, it will restrict. It will say, no, you can't open. Okay. So that's the beauty of the joint. This is how usually it functions. Like when we open, these disc will move on the condyle, and the movement of disc is through the ligaments, which pull or push depending on the function. You want to move it right, left, or open, close, depending on what you want to do. The ligaments will help in moving the joint in that direction. So all these things are well controlled through neural networks, and this neural network is also dependent on the emotional state of the patient. Okay, that's where the cause for temporomandibular disorders will take a very important lead. So I'll just talk about it a little later. So coming to what are the causes or what are the main functions of this TMJ? It is movement of the joint, open, close, movement, lateral movement, that is sideways movement, right, left, sideways movement, and open, close movement. When we do this open, close movement, while chewing, while speaking, while swallowing, to a certain extent. And some people have right-sided, predominantly they use the right side of the dentition for chewing. Some people use left, some people have this balanced thing. All these things depends on how they train their joint to chew. That has been inherent inbuilt property of the joint. So when something goes wrong in this whole mechanism, that is, if the disc is not positioned properly, the pad is not sitting on the bone properly, or if the ligaments or the springs are very loose, or if the patient is doing excessive movement, is supposed to do, say, for 20 minutes, the movement has to be done in a day, but he's doing it excessively, like talking, or he's in a profession where he's putting constant pressure on the joint. All these things, we call it as micro trauma, that is small in a microscopic way or in a very subtle way, the joint is getting affected. However, we have macro traumas, that is the
accidents.
Disturbance to the joint is in a big way, like in a road traffic accident, or patient is getting hit with something hard on one side of the face. All these things are obvious, like the patient knows, okay, this is the reason why I have the pain in the joint. Whereas the micro trauma is the one which the patient has developed a habit for doing it, that is excessive use of one side, keeping a mobile phone on this side and working, or supporting the chin like this and working, okay, or sleeping on the stomach and reading a book. All these, we call it as abnormal habits, which will lead to a change or some kind of disturbance in the normal biomechanics of the joint. This will lead to the signs and symptoms.
So if there is this kind of what you call as this micro damage that you said, sir, which happens on a kind of a daily basis, which the patient is probably unaware of, he doesn't know that these kind of habits actually lead to some kind of a damage to the joint. How will it show up in the patient? How will he get to know that probably he's causing this damage to himself unconsciously?
Yeah, again, it depends on the degree of the habit, that is the degree of severity of the habit. If it is a very subtle or mild habit, it takes years together for the signs and symptoms to manifest. So one of the most common things what we see in our day-to-day clinical practice is the clicking sound, which is heard during opening, closing, or when they are eating, chewing function, or when they open very wide, especially when they are eating a pani puri thing or burger. So they have to open really wide, and this will lead to a kind of clicking sound. That is the initial manifestation. Okay. The other very common thing what we see in youngsters, especially the youngsters 25 to 45 year age old group of patients, is the pain in the area. Okay. Usually they complain of this pain in such a way that it's a kind of a dull ache, which is not very severe, so that they need to take medications. No. And it doesn't interfere with their day-to-day activities in the initial days. Only in the evenings or early mornings, they feel some kind of uneasiness in the ear region. And when the severity increases, maybe they will have pain in the ear, or it may go up to the pain in the head. That is, this headache will be there on one side. And we've also seen that the pain extends into the neck region, back and neck region. And then it becomes a very severe problem where the patient's quality of life, what we call, starts coming down. They go into depression and so many things because the severity will be that big. Otherwise, usually it is the click or occasional catch when they are opening and closing. And usually they neglect it. And the other thing is the small pain in the ear region. So these are some of the very common things what we see. And usually patient neglect this because it's not hampering their day-to-day activity. That's the reason why this disorder progresses to something serious later on in life.
So, sir, what happens at this stage if the patient observes, or probably sometimes they may confuse it for a tooth pain, because if they get a pain on this side and they say, okay, we may have to see a dentist, and they come and say probably it's a tooth pain or it's some kind of a pain, they complain. So what is the kind of treatment that would be possible at this point, at the early stages?
So usually we treat these conditions through counseling sessions and physiotherapy. That's the only thing which is required in the initial days. Say a patient comes with a complaint of click. Okay, so first we need to identify what has caused this click. What is the reason behind it? Otherwise, whatever we do would be a waste of time and our effort. See, click happens because I told you the disc or the pad is sitting on the joint, and when we open and close, the condyle or the lower mandible or the lower jaw and the disc has to move in a synchronized fashion. And this movement happens because I told you the disc is connected to the condyle through ligaments or springs. So when a patient is having an abnormal habit of clenching or bringing the teeth into contact or working on one side, any of these things, slowly these ligaments starts becoming elongated, like it's rubber band. You keep stretching the rubber band, it loses its elasticity, though it doesn't break. Same thing here, ligament doesn't have a tear or anything. It is just the ligament loses their elasticity and it allows the disc or the pad to move faster than the bone, and this will lead to the click. So how we address this is tightening the ligament. When you tighten the ligament, automatically it becomes normal. So for tightening the ligament, you need to come out of the habit. Because the loosening of ligament has happened because of the habit. That is, you're on one side bone, or you're holding like this, or your teeth are into constant contact all the time. So these things will have to be, slowly handled. So for that, the patient is asked to be aware of their dentition. If they are holding a mobile and multitasking, we ask them not to do it. If they're having the habit of holding the chin on one side and working on the computer, we ask them to change that habit. Maybe initially 2-3 days it may be difficult for them, but slowly their brain will start noticing that, okay, this is a wrong habit and I have to come out of it. It's just an auto suggestion kind of a thing. Slowly they come out of it, and I have seen within a month's time, most of the patients, if they really put in an effort, they are out of this habit. So once they're out of this habit, so there is nothing to hamper the elasticity of the ligament. Then your physiotherapy starts, where we ask them to open and close their mouth against resistance. Like when they're opening, we ask them to put a upward pressure from behind their hands, and this will slowly tighten the ligaments. And in a matter of 2 or 3 months, the intensity of the click reduces. So this is one way of handling it. If a patient comes with a lot of pain in this area, then again we ask them to identify the cause, what has caused this kind of muscle spasm. We ask them to do some diet restrictions, like being on soft diet for a week's time or 10 days, soft food, and not opening their mouth very wide. Okay, and if the pain is very acute, we put them on some muscle relaxants for 5 days. A lot of simple, very commonly used muscle relaxants are there with minimal side effects. So we put them on muscle relaxants, and then we ask them to do a physiotherapy exercise of keeping hot bag, that is hot water bag, in this area where skin can tolerate that temperature. It should be that warm, not very hot that scald the skin, but it should be a tolerable, very pleasant warmness. And we ask them to keep it in the ear area and ask them to open and close slowly. Daily, we ask them to do it for 2-3 times for 10 minutes each. This will help in relaxing the muscles. Along with the muscle relaxant, usually patient will come out of the pain. And very few cases where the patient has the habit of grinding their teeth in the night, we call it as bruxism. This is one of the main causes for the TMJ problems. And if we find that patient is a bruxer, then we take the impression of models for a lower teeth, and then we give them a kind of a guard, which will help in dissipating or distributing the abnormal forces of bruxing, and it will go into the orofacial area and damage to the TMJ is minimized. So these are some of the very common things what we do. But again, examination by a dentist and this thorough history taking is very much essential. And to rule out some bony problems, we may ask for a OPG, a jaw X-ray, which will give us an idea about the bony component. So by doing this, I think most of the problems can be tackled.
So, what would be the precautions that patients can take, like to ensure that their joint is also as healthy as their mouth?
Yeah. See, as I told you, all these things are because of abnormal habits. First thing would be to be aware of these abnormal habits. If they're doing any of these, multitasking with phone in one hand, or watching or reading a book with one support of this thing, or if they're bringing, like when we are at rest, when you're just sitting and seeing something, we have to observe the teeth. Upper and lower teeth shouldn't touch each other in a resting position. If it is touching, then your joint will definitely go in for a problem maybe after 5 years. So if anyone has this problem of not crunching or crushing the force, not the grinding force, but even a normal small touch, a light touch of upper and lower teeth in rest position is not allowed. So if they are aware of it, they have to immediately tell their brain, okay, no, this is an abnormal habit, and open the mouth. Immediately the patient will be relieved of this. So if they practice this for a month or 2 weeks or 3 weeks, within a month's time, the brain will know that bringing teeth into contact is an abnormal thing, and it will automatically come out of that habit. That is one of the very important things. And acute trauma, like if they have undergone a dental procedure for 1 hour, opening very wide, so slowly within a month's time, again, by doing this limited opening thing and soft diet and hot water fermentation, slowly the thing can come. So the precaution would be to be aware of the abnormal habits. And if they develop a click or some kind of grating sensation in the joint area, or a earache and headache, okay, and which is very evident in the early morning when they get up, it is better to consult a dentist as soon as possible. And in the history, dentist will be able to pick out what is causing the problem, and he will be able to tell you the future course of action.
Sir, and also what happens is sometimes very commonly as dentists, we get asked, is chewing on the gum, is that healthy or is it not healthy? Because I think on the net, when our patients search for information, so many times there are advertisements which say that chewing on gums helps in so many ways. They're promoting their products in so many ways. So we do get asked constantly about chewing on gum. So do you think chewing on gum as such is a healthy habit? I mean, would that affect the joint anytime in the long run?
See, I'd like to answer this with a small example. Okay, if you search the net for is doing gym or pushing weights, okay, in a gym is healthy or not, you will get obviously the answer is yes. But we assume that that is done for say maximum 1 hour, 1.5 hours, 2 hours. But if you have a habit of starting it at 6 o'clock in the morning, ending it at 9 o'clock in the evening, every day you push for around 13 hours, is it a healthy habit? No. The same thing here. Our jaw, upper and lower teeth, along with the muscles and the joint, is for some limited functions, like we chew. Maybe you take a breakfast for 20 minutes, lunch for half an hour. and maybe a snack and here there. Totally around 1.5 hours of chewing is allowed. That much the joint can bear that stress. But if chewing gums, what happens? You're doing it continuously. Just imagine what will happen if you do 13 hours of gym. Same thing here. You're doing a micro gym for the jaw. That is your jaw muscles. If you see people who grind their teeth and lot of chewing action, what they do with chewing gums, they have very bulky cheeks. That is because their muscle, the masseter muscle, yeah, like your biceps, masseter also bulks up. So it's not a healthy thing in the long run because ultimately your joint function gets compromised. You may develop an arthralgia, that is arthritis like knee arthritis, or the muscle spasm may be there. Whatever, everything, nature has a particular way of keeping all these things in place. If you overuse it, no, it's not healthy at all. This is my opinion. I don't. People may have different things, but I see it in this way: 20 minutes to 1 hour for every 3 hours is the one that we can use. And if you keep chewing gum, it becomes an obsession. And I think the joint cannot take up this kind of stress.
It's like exactly like how we give rest to any other body part. Even that part needs rest, because apart from, I think, talking, chewing, swallowing, I mean, even at rest, if you are stressing out the entire structure here, then obviously the muscles and the joints don't have a rest phase. So that's when I think it breaks down.
Yeah, that's why people have headache, people have facial pain, neck pain, a lot of other things come into picture, and it becomes a psychosomatic disorder. Like slowly the patient will go into depression because of this constant nagging pain. Luckily, what I have seen in my research is the Indian population, they are they are more robust in managing these stressful conditions. Not like Western and European or American literature, we find that most of the youngsters, because of the pressure in the work, pressure in college, pressure from family, they undergo this TMJ problems, and the severity is quite, big. That is, their quality of life comes down. But in Indian scenario, I have seen cases where they say, yeah, click is there, it just goes, I'm not bothered about it. That kind of a thing. Maybe the attitude towards awareness and the awareness about the symptom is quite different. This is quite differently expressed in Indians when compared to the Americans. So that is one good. We will have these problems very often, and a dentist may have to be aware of these conditions.
Sir, I think that was a very informative talk on what probably sometimes goes unnoticed by a lot of people, lot of times. And I think this talk was helpful to all our patients in understanding that in case they have any of these symptoms, they have to visit their dentist first, and their dentist will further be able to guide them and tell them on what exactly has to be done.
Yes, definitely. There is no self-medication here. You'll be harming your joint if you start searching the internet, because we need to pinpoint the cause. So that can be done by a dentist by proper history taking. So it was wonderful interacting with you for the benefit of patients. So thank you, Dr. Rick.
I should thank you, sir. I should thank you so much for joining me today. I probably, it was a pretty short notice, but you were so graceful that you came over and shared your experiences with our patients. And I really hope I can get you back on this talk to share more of your experiences and knowledge on specifically TMJ disorders and probably all the other research areas that you're doing.
Yeah, definitely, doctor, because I have spent 7 years doing PhD in TMJ. So it doesn't require any preparation for me to talk on TMJ. So I'm always there if it suits my thing. I have given you my areas of interest, so I can talk hours together if given a chance. Thank you. Thank you.
Thank you so much.
Thank you.
Viewers, that was Dr. Subhash, who did share with us his expertise on temporomandibular joint disorders. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. So for more information about your oral and dental health, visit our website www.thedentaire.com. Subscribe to our YouTube channel and you can follow us on social media platforms. So until next time that I come back with another dentist to share with you their knowledge and expertise on your oral and dental health, keep smiling, stay safe and be happy. Thank you.